And so the first question that we had asked, and some of this you may have addressed in your small groups, but I think other people didn't have the advantage of maybe the conversations you've had at your table. So the first question I asked of all the panel members is, are there any efforts underway to address the funding cliff that obviously Dana referenced that we're going to face when the sales tax expires in 2014? So this is the beginning of the good news.
Yes, there's one major effort that you all should know about, and hopefully you know about already, and Janice is very involved in it, and that is a citizens ballot initiative called Quality Education and Jobs to renew the temporary sales tax and to dedicate the funding to specific areas of K-12 education, higher education, vulnerable families, lifting the freeze on kids' care, state infrastructure. Am I forgetting anything?
And we have a handout on the tables. We actually did make a handout of all of that.
So, I mean, that is a really exciting opportunity for citizens to take the priorities into our own hands and to have the priorities reflect what we care most about. It does address the fiscal cliff. It doesn't solve it. It doesn't solve our budget woes forevermore, but it is a huge step. And then also to really invest in those key priorities. So, no, it's kind of,
how much is it predicted that it will produce in terms of revenue?
it's about $1 billion.
Over $1 billion.
I have a friend that's working on it.
And on the handout, they actually did a great job of kind of showing on the back of that handout. It'll show you where all the money goes. And the vast majority, about 80%, is going to K-12 education, and then you probably have about 10 to 12% going to infrastructure, so PERF funding for highways, construction, and then kids' care is what, about?
it looks like this is the green sheet, so hopefully you all
So
have
it's
one.
probably 2%. Okay. So it's significant.
And one of the things we've been putting this information out, encouraging nonprofits to take a look at actually taking the position. Yes, nonprofits can endorse ballot propositions, unlike they can endorse candidates, but yes, they can endorse ballot propositions. So, and we're actually encouraging nonprofits even who are not directly in a line item here affected to consider taking the position, because if this doesn't pass and the cliff happens, the ripple effect on all the other funding sources and so forth, some of us were talking about this at our lunch conversation, is going to affect all nonprofits. So we hope that the sector widely takes a position.
Isn't that sad? Like what Dana talked about. I mean, it's over $1 billion, and it helps, but it doesn't solve the problem. Yeah. I mean, it just goes to show, it's not funny. It's funny sad of how far we have to come back, and it's just a few years. There's a lot of rebuilding that has to be done. The only thing I would add on this, and just to go to show kind of where the difference is, and I think it goes to Dana's point about lack of vision from the legislative aspect, is that I would say the biggest thing that they have been looking at, well, I'd say two areas. There's a legislation passed this year to look at a transaction privilege tax committee to how we redo our tax structure in order to make it more viable.
That's our sales tax for anyone who doesn't know.
Well, what was interesting is the sales tax committee, but they're also asked to look at income and corporate and individual income tax, as well as how to address city and county issues. But it's a study committee, and we know what study committees usually mean: kick the can down the road. And the only other item is the Arizona Ready Council that the governor has created to talk about some education issues or some longer term planning. And they have really yet, I think that they will, but they have yet to really produce a framework for where things are going. So it's really in the hands of citizens if we want to see some tangible results. It's just not coming from government.
Can I ask a question? How do we restructure our state to where we're not so dependent upon revenue from sales taxes and construction type stuff? Because manufacturing is just because supposedly just in the lack of car sales, I heard there was $1 billion in sales tax revenue that was lost just from the lack of car sales in 2009 or 10.
So there are pretty clear policy answers to that question. It's not rocket science. The overall answer is broadening the tax base, so getting rid of loopholes and exemptions, lowering the rate, also raising our state income tax in a progressive way, meaning higher income people pay a higher rate. We have a very low individual income tax. Any of you who moved here from another state, you might remember that when you moved. Same thing with residential property taxes, extremely low. So the policy answers are actually pretty obvious, and there's tons of research and documentation and options out there, and I'm happy to sit down with you and go over them with you. It's the political answers that are really, really, really tough and lacking. So first of all, there has to be some oomph to do it, and we've lacked that oomph. I mean, we've really lacked that political will and visionary leadership for quite a while. It's not just the last 3 years, it's quite a while. So that's why we really have to build up the community conversations and help people connect the dots between showing that the fiscal system is not getting us to the goals that people want. And then there really has to be some strong leadership both inside and outside government to bring that together. So it's a tough mountain.
And I want to applaud Dana and their work they've done in their budget work. It was a few months ago, your publication, I'm trying to remember the name of it.
Skin in the Game.
Skin in the Game. That publication to me is one of the best things you've all done ever. And it's so powerful to tell you who's actually paying taxes, who's actually paying the taxes in Arizona. And I think if people got that message more widely, they would jump, there would be a broader base of political will formed to reform the system. Because it's not a matter of like, yeah, we know how to fix it, it's the political will to do it.
Sandy?
Well, looking for the political will, I think this information, which is available in support for the referendum, has to come from the board leadership of foundations and from the board leadership of not-for-profits. The professionals are not strong enough to carry the ball on this. The Arizona Grantmakers Forum and your organization, Pat, have to get board members who represent broad communities throughout the state involved in this, and information like Dana's report and so forth has to be distributed to all these people. The foundations can play a key role in paying for the costs of that. It just can't be professionals meeting in a meeting like this expected to carry the ball. This story has to get out to the board leadership of the foundations and to the board leadership of the not-for-profits. And right now, I don't hear that happening.
Point well taken. Yeah. Okay, I mean, I think we could talk about this issue all the rest of the afternoon as well, but let's try and move on to some other questions, and thank you, Sandy. I think this is one, and Janice, you might have been hinting at this with your remarks earlier, but major education reform efforts, you suggested the Move On When Reading and the Common Core standards and all the others that were passed in 2010. The question is, how are they being implemented, and are there opportunities for funders to support some of these efforts?
I think there's huge opportunities, and part of what we were thinking about is that if you're a funder, you want to be able to invest your monies and be able to see some tangible outcome that is worthwhile. And I think there's two opportunities. The reading, we talked about that a little bit earlier, about the opportunities to kind of leverage some of the state funding as well as what's happening with First Things First and some of the other folks out there. But also Common Core standards. Common Core standards, they have been approved by the state of Arizona for English and math. And the assessment will come online in the 2014-2015 school year. So folks are now within the school system starting to ensure that their curriculum is aligned and also have teacher training be applied, because the standards per se are not that different to the standards that we've previously had. The depth of knowledge that both educators as well as kids are going to have in applying these concepts, that's the real change. It's a depth, not a width type issue. And so I think there are huge opportunities of helping with the technical assistance and the teacher training as it relates to Common Core, and especially through regional centers. So if there's regional funding opportunities, they're really being spearheaded by five regional councils within the state the governor has helped put together, but they are underfunded. And I think that at least it won't take huge amounts of money, I think, to make a very, very strong difference in that area.
Okay, here's another question, and this is for Kim, although I think other folks can have something to say about it, but how is the Supreme Court decision regarding the Affordable Care Act expected hopefully in June, to impact healthcare delivery in Arizona? And what are some possible scenarios? We don't know which way the Supreme Court's going to go, but I know Kim's been thinking about this.
Yeah, I think nobody should ever bet on what the Supreme Court decides. So it's certainly, the future's uncertain, but we can sort of broadly think of a variety of scenarios. One would be that the Affordable Care Act is upheld, and that could have some profound implications for our state in terms of some of the budget cuts that we've witnessed in the past few years. So, for example, the Affordable Care Act will expand Medicaid to up to 133% of the federal poverty level beginning in 2014. So essentially, a lot of the folks who've lost coverage through access would regain it because of healthcare reform. It will also create what's called a health insurance exchange, where many people will be able to get subsidies for health insurance. Again, helping a lot of the folks who basically have been hurt by some of the state budget cuts that have happened in recent years. A lot of these changes, though, don't happen automatically. They also require some public policy decisions to be made. So, for example, the creation of an exchange requires some actions by our state government to be able to implement the exchange. Certainly some things have been happening through the governor's office, but more probably needs to be done to be able to actually implement an exchange effectively. And not all of it is the role of government in terms of actually making these things happen. So, for example, we as funders can play a role in trying to create community awareness about some of these big public policy changes. The Affordable Care Act, though, we were talking back in our corner, is far more than just a piece of legislation that talks about coverage. It also contains a lot of components that talk about quality and how to improve the healthcare delivery system. And at the end of the day, we're seeing a lot of those changes happen anyway, whether the Affordable Care Act moves forward or not. And it's really being prompted by the rise in healthcare costs. And this is creating really new incentives and new concerns about how do we more effectively provide healthcare. And what will make a difference is really how we as local communities respond to the need to improve our healthcare system. And certainly I think one of the things that funders do really well is make investments in terms of that kind of innovation. And I think that those types of investments are critical. So, one scenario is the Affordable Care Act is upheld. Another is that it's completely overturned. As we've talked about before, some of the changes will continue in terms of innovations related to our healthcare delivery system, but we'll be facing some big challenges for our healthcare providers that are facing big coverage cuts right now. And access to care for a lot of people will diminish if that were to occur. And then, of course, you have a scenario somewhere in between where you have some sort of mixed decision, and that could be a variety of scenarios. The end of the day, what we often talk about from our foundation perspective is that whether you support the Affordable Care Act or you don't support it, the reality is our healthcare system's changing. And it's changing because of state budget cuts, but it's also changing because we just have to figure out a way to deliver healthcare more effectively and increase access to care and conserve our dollars. So that really creates a challenge for us as funders in how to make that happen.
Do you think there's anything in the works, whether it's led by St. Luke's or somewhere else, regarding a response once the Supreme Court decision is known? In other words, and then we can better project what impact it's going to have. Is there anything sort of teed up to respond to that?
There's some discussions right now with some providers about maybe teeing up some communications responses depending on the results of the Affordable Care Act or the Supreme Court decision on the Affordable Care Act. I think that many providers, I think, are almost in this state of denial right now that they are very much depending on the coverage expansions to be able to continue to do business. It's going to be, quite frankly, a real game changer if the Affordable Care Act were to be overturned and those coverage expansions don't occur, because it's going to really place a large amount of stress on our provider community that's been looking at that as sort of their salvation to address the big cuts that they've incurred over the last few years.
Patrick, I don't know if you want to sort of respond a little bit. I know you were talking at our table about just the impact of the insurance companies saying, well, the exchanges are going to be set up, so we're not, at this point anyway, thinking of doing anything more to help nonprofits, the small nonprofits, get access to healthcare. It might be worth it to share with everyone. Just
Sure. Well, you know, when the Alliance was formed 7 years ago, many people thought we were formed to provide health insurance for nonprofits. Some people thought it was the only thing they had in mind. And as we have worked on it throughout our time. We've tried a number of attempts in different ways. Ultimately, the challenge in Arizona is that our law requires that health insurance be provided through employers. You cannot put a bunch of employers together and make one big group. It used to be allowed, but 20 years ago the law was changed and you can't do that. So that creates a barrier, but some have worked around that barrier. For example, the largest school districts, several of the largest school districts in Maricopa County have a trust where they negotiate together. My wife works for one of those districts, and it's still really expensive, but if they didn't have the trust, it'd be even worse.
Wow.
I mean, and essentially what the trust allows you to do is to just take care of some of the marketing costs that the insurance company normally would do on their own, with those groups separately. That's basically where they give you the savings, because they don't have to do some things that they would have to do otherwise. Because I mean, I don't know the insurance business or the health, and partially through the pool and whatever, but basically, there's a pretty significant amount of premium we all pay that's, or whoever pays your premium, that is just the marketing costs, let alone the administration of benefits, all that. It's just the marketing costs. Anyway, so that's where they'd find the savings. So we were working with a company that had also created one of these trusts for charter schools, for the Charter School Association. And that currently exists. So we were looking at, could we create, we actually have an even bigger pool if we look at all nonprofits. And we were this close. We actually had the carrier, we had everything lined up. And then the Affordable Care Act was signed, and they first said, time out. We have to see what the impact of this is going to be. And then they came back and said, basically, they're getting out of the under 50 employee business because they're pretty much going to go into the exchanges. So, well, you know, the nonprofit workforce, right? Our average number of employees is 6. I mean, over 50 is a rare number in nonprofits. So essentially, they were no longer interested in working with us. So, you know, and we asked them even, can we at least do a gap thing? One, I mean, of course, very quickly, then we all learned, well, it may not go into effect. So, but we still would have, at that time, it'd be 3 years or almost 4 years, and they still weren't interested. So it's been tough trying to negotiate anything for our, you know, small business nonprofit sector.
So stay tuned. This is a question for Dana, but I'm sure the rest of you may have something to say. We're hearing a lot in the media about Kids Care 2, the new program that will allow children once again to enroll in Kids Care. But does this mean that Kids Care is being fixed and that kids once again will have access to public health insurance?
Well, some kids will. It's not a fix, and in fact, as Kim said, the freeze is still in place, and the legislature actually cut the budget for Kids Care, because as the freeze continues, the enrollment dwindles. So Kids Care 2 came about because of 3 hospitals and the Obama administration investing in children's health. And what happened was hospitals who are really struggling with all of the uncompensated care that Kim talked about went to the feds and said, you gotta help us, can you help pay for uncompensated care? And they said, you know, we really don't want to talk to Arizona unless you do something about Kids Care. I mean, we are the only state in the country that has a freeze on kids. We're the only state. So because the Fed said, you know, come back and talk to us when you're ready to talk about Kids Care, they did. So the hospital said, okay, and it's Phoenix Children's Hospital, Maricopa Integrated Health Service, and University of Arizona Medical Center in Tucson. And they said, we will put in $10 million of our hospital money. We're drawing down 3-to-1 federal dollars. It's time-limited coverage. So the clock is literally ticking. It ends December 31 of next year, right before, presumably, federal health care goes into effect. And it's for 22,000 kids, only for kids who are on the waiting list now. So it is a great opportunity, and I hope you all got our flyer by email. We'll send it out again if you didn't. We're trying to encourage folks who are on the waiting list to call the hotline and update their address, because if they don't get the letter in the mail and do something about it, they lose their chance. But it's 22,000 kids, time limited. The quicker we get them enrolled, the better off we'll be. But it does not lift the freeze on kids care.
And remember, the waiting list has 105,000 kids on it, so.
To
Wow.
Okay, last question from us, and then we're certainly open to any questions that you have. Are there opportunities for philanthropy and nonprofits to work together to address some of the public policy concerns raised here today? Patrick alluded to some good things happening elsewhere. So
Yes, so I finally get to tell some good news. So we are a part of the National Council of Nonprofits. For those not familiar, that's a national organization of more than 25,000 nonprofits around the country through the state association. So all of our members at the Alliance are members of the National Council, and likewise with the other state associations around the country. The National Council of Nonprofits has been involved for a couple of years working in partnership with the Urban Institute on looking at these government contracting issues that I mentioned earlier. And what's happening now is you're starting to see states move the policy dial on these issues. The most exciting one, just from a I don't know, PR perspective maybe, is that Connecticut last year became the first state. So yes, what are we, 230 years into this? Nonprofits have been around forever, and we've never had a cabinet level position dedicated to looking at the interplay of government and nonprofits. But Connecticut became the first state to appoint a cabinet level nonprofit human services liaison. And then history was really made when New York actually followed Connecticut earlier this year. They don't normally like to follow Connecticut, but they created a cabinet level position as well. So one of the things that's starting to happen is that people are realizing that if we're going to work at a higher level of reforming this partnership, we got to be working at a high level, and that includes right there in the executive office of our state governments. Other things that are happening, and I'm just going to give a couple of examples. There are at least 15 states where some real interesting activity has already taken place or is underway or at some stage of development. Usually, many of them are dealing with some sort of either prompt payment issue. So when this project started a couple of years ago, it was actually spawned by a concern about nonprofits not being reimbursed by government in a timely fashion. And that's such a polite way of saying it, quite frankly. It was scandalous what was happening in some states. In New York State, for example, there were nonprofits that had been waiting for 3 years to get reimbursed on the government contracts. I don't know how they stayed in business. Yeah. In the state of Illinois, at the time that this was first launching, I think the state was in arrears by about $3 billion collectively to the nonprofit sector. I mean, there were some really just horrible things going on in delayed payments. Now, just so you know, Arizona actually did pretty well on that measure. That was less of an issue in Arizona than some other states. And even nationally, that turned out not to be the most significant issue. Paying the full cost of services that I mentioned earlier, complexity of processes, unfunded mandates basically through government contracts. There were other issues that actually turned out to be more significant collectively than late payments. So a variety of efforts in states are to either, in the state of Illinois, the Donors Forum. Donors Forum is kind of a combination of Arizona Grantmakers Forum and the Alliance in Illinois. And they actually have worked with state government to create this joint commission with the state leadership from both the legislature and the executive branch and Donors Forum to bring together stakeholders. And the first thing they did was develop these principles for government and nonprofit partnership. And that's actually kind of I think a seminal document for us nationally in this whole partnership idea. Now they're trying to turn those principles into legislative changes. And they haven't had any big successes yet, but they're underway. A couple of other states have actually had state-created commissions, either through the executive branch or the state legislature. The one I'll highlight actually is the state of Texas, because you think of sort of, you can find some of these more blue states doing these things maybe, but you know, the state of Texas actually has a statutorily created commission. Sorry, I was finding in my notes what they're called. The Texas Task Force on Strengthening Nonprofit Capacity. So they're now underway trying to figure out how to essentially strengthen the nonprofit sector as an important partner with Texas state government. There are some other examples of what states have been doing. I just use those to highlight it, but we have some models to work from. We don't have to totally, I mean, of course we'll do it our own way. But we can take some lessons from those. And like I said, we are looking at whether, we think that the issues go beyond just procurement reform, and we think that there are kind of, there's a larger frame than just how a contract is. By the way, I don't know whether most people realize in Arizona, this is not true in every state, we don't actually have anything that's called a grant at the state level. Now, sometimes they call them grants, but technically under Arizona law, you never have a grant, you only have a contract. The only thing state government can do is basically buy pencils from you, okay? I mean, you know, it's buying pencils from you or giving you a contract for state services are essentially the same thing. It's because of our Constitution, which says that if I were to give you a grant, it violates the gift clause of the Constitution. So that's why some people may think of, what about grants? Well, technically in Arizona, yeah, I mean, there are things that we may call grants, or some people, they may even kind of label them grants, but they're always contracts. So that's why you look at it in procurement, and if you get too caught up in framing it the same way as buying pencils, you might lose sight of some of the larger goals that we're trying to achieve that you might think of, you know, like when we work with you all as funders on a grant, we can have a different kind of conversation than, you know, with somebody that's buying pencils from you. So we want to have that larger conversation, not just look at it from a procurement standpoint. But that being said, I think we can use some of the examples in the other states as models for what that conversation can look like between state government and also local governments. I think we need to have local governments in this conversation as well. It's an important part of the mix.
Okay, opportunity for questions from the audience. Really good responses to those questions. Is there any stone left unturned at this point?
I have a follow-up question for Dana regarding the sales tax, the 1%. Is there a provision in there to prevent or at least make it more difficult for the legislature just to make a subsequent cut to education and divert that money to refunds or something?
I'm glad you asked that. Actually, the initiative says that legislative appropriation for K-12 can't go below, I think, current year, a certain number or something. So there is a floor, so they can't go below the floor. Same thing for universities. And then there's also other language in there to attempt to prevent supplantation. But the K-12 and universities are actually locked in kids' care, so to speak, because it lifts the freeze and provides the funding source. Anything else that's locked in?
No, I think that's important, and some of the action, because there really hasn't been organized opposition coming out, there's just been kind of scuttlebutt, but there is that floor, and it's based on a monetary amount. So let's say that the legislature were to go in subsequently to change the funding formula of how things get distributed, they would still be obligated to that number per pupil. So there's non-flexibility and flexibility. Because a lot of folks are saying this locks us into our outdated funding formula, and that's not true. It just locks us into a number.
A number per student.
Per student,
yeah.
correct.
So thank you for asking that. That's a really important one. And I think voters are actually very attracted to that because it really does give voters the control versus the legislature. Of course, legislators hate that, but that's the choice.
Dana, here's the question regarding the $50 million basic that they took from the mortgage assistance, and now there's a pending lawsuit in the Affordable Housing Alliance. What do you think the impact of that is, short-term, long-term?
Well, I don't know how the lawsuit will turn out. It's a very odd situation because Attorney General Tom Horn who negotiated the settlement, the legal settlement, says publicly, he's saying that he advised the legislature not to do the sweep, but now he'll defend it. So it's very, very odd. I don't know how it'll turn out legally, but I think it's a really important election year issue, and I hope candidates who oppose that sweep are using this, because it literally, very literally, took money away. The money was supposed to be used for mortgage counseling, because the settlement makes, I don't even know what it's called, like refinancing packages available to people. But if anyone knows who's tried to deal with a bank on a mortgage, it's very hard to navigate that, and we know what happened federally when there were these programs. People never got them and never got the rewriting. So this particular fund is to provide that counseling, free counseling, to help people navigate the system to get the benefits they're supposed to get. Well, if you take away that middle link, then people are not going to get the refinancing. So it literally is going to lead to more foreclosures, more people out of their home. And essentially it's money they put into the rainy day fund to then give out in tax cuts in future years. So I hope that politically it has an impact. I think it was a very egregious decision.
Yeah, I just had a question. What is the per pupil amount right now by law?
It is, from just state funds, it's $3,200. That's just state fund, to be very fair. A lot, most districts receive some federal funds, but it's different depending upon how many free and reduced lunch kids you have. And then also there's the local levy for overrides and bonds. That also is different. So if you probably added that all up, I would say it's probably an average of about $5,200 to $5,400 per child.
And how does that compare to other states? Are we,
we're not number one.
Are we 51?
Yeah, we are. We're 51. No, I was just saying, because you were saying that we're so bad at that. We're not there. Yeah, we're still 49th. And you know what? I should bring up, because we're 49th in the country in how much we spend on education. And we had some folks, we call Chuck Essex from the school business officials, our school finance guru. If the Quality Education and Jobs Initiative were to pass, it would take us up 7 places. So, just to give perspective.
Just one more question. I know some individuals out there have commented about accountabilities that are built into this. Could you comment a little bit about that and where the accountabilities are?
That has been one of the criticisms. No, that's fair, because I think that's important. One of the criticisms about the Quality Ed and Jobs has been that there's no accountability for this large influx of dollars. And there's actually 5 different areas that are required for those monies to be focused on. The large chunk of money that goes to education. And it's all around the major reforms that were passed in 2010. So Common Core implementation, K-3 reading, the school accountability issues, and teacher and principal evaluation, as well as innovation. So those are the 5 areas that those monies have to be dedicated to. So pro-con, the folks that have written the initiative say we're giving school districts flexibility in order to figure out how they want to do it, but it does have to be focused in those areas. The con side would say we want a 1-to-1 ratio, so we show how this $100 million would go specifically for teacher and principal evaluation. That 50 million would go for the quantitative assessments, and 50 million would go for evaluators. So I think it's the level of specificity that people have that have challenges, but to say that there's not accountability, I think would just be wrong. I mean, it specifically says where those monies have to go.
Other questions?
Marissa,
Yeah.
I'd like to make a comment. I want to applaud Arizona Grantmakers Forum for their policy committee and the work that it's been doing. We have a shared membership on the Alliance and AGF Policy Committee. And one of the things that I think is significant coming up in the fall is a conference dedicated to the roles of funders and how you can advance philanthropy's role in both doing and supporting advocacy and policy work. I hope this presentation today has been a snapshot, and there's so many other aspects to it, of course, than just the budget, but of why it is so important. And so thank you for being at the table as we advance this board.
Paid endorsement. We should acknowledge Patrick too for the work that he has of his own public policy council, and a number of our committee members sit on that. And Patrick's done a whole lot of work, more in the weeds, working with the legislators at this point, creating relationship and understanding. So I think collectively we're going to be a lot stronger than either part of the sector could alone. So that is one of the good news pieces to share, is that we're beginning to organize around this. With that, then, I'd like a round of applause again.